Greetings from Sydney. Have you got early non-alcoholic fatty liver? I would like to thank ChatGPT, my education partner, and also my children, Deenan and Jazara, for making this video possible. This video is for educational purposes only and is not a substitute for medical advice. Always consult your doctor before making changes to your diet, medication, or lifestyle. Why should you be worried about early non-alcoholic fatty liver? The RACGP, that's the Royal Australasian College of General Practitioners, guidelines identifies insulin resistance and metabolic syndrome as the core drivers. Early diagnosis can save your liver and save your life. But what is worrying is that 1 in 3 Australians have some degree of fatty liver. But don't be alarmed, not all progress to cirrhosis or needing a liver transplant. 30% of adults in developed countries, such as in Australia and USA, have non-alcoholic fatty liver. But what is worrying? Over time, fatty liver can lead to liver damage and cause severe problems like cirrhosis, liver failure, liver cancer, and health problems. Non-alcoholic fatty liver disease. The definitions have changed slightly. Now let it make it as simple as possible. Now they have now changed it to metabolic. So let's call this non-alcoholic fatty liver disease as MASLD. That is accumulation of fat in your liver because of extra body weight, high blood sugar, high triglycerides, high blood pressure. And the other serious component, MASH, that is, you got buildup of fat and you got inflammation. Let's now look at MASLD. The cause is unknown. It's linked to insulin resistance and metabolic syndrome. It's linked to obesity, insulin resistance, metabolic syndrome, type 2 diabetes, and high triglycerides. Who is at risk? It's most common in middle age. Children and young adults can get it. The risk factors are excess weight around the belly, high triglycerides or LDL cholesterol, type 2 diabetes, high blood pressure, polycystic ovary syndrome, sleep apnea, and hypothyroidism. MASLD, it's a silent liver disease with no symptoms at all. MASH, on the other hand, you get severe tiredness, pain in right upper belly, weakness, weight loss, yellowing of skin, spider-like blood vessels on the skin, long-lasting itching. When MASH becomes serious, that's hardening and scarring of the liver, leading to cirrhosis, you get extra fluid buildup, muscle wasting, and confusion. If you're worried, how does your doctor check? Usually it's a blood test. They do the liver function tests and look for your ALT, AST, and your platelets. The Royal Australasian College of General Practitioners recommends the FIB-4 score. It can be calculated by a doctor. You need 4 results: age in years, AST from your liver tests, ALT, and your platelet count. Interpretation of the FIB4. In adults between 35 to 65 years old, it should be less than 1.3. That means you've got a mild, low risk of fibrosis. It can be managed with lifestyle changes. If it's 1.3 to 2.67, it's intermediate. You might need an ultrasound or fibroscan. Above 2.67, it is advanced. But the cutoff, these figures differ if you're under 35 and above 65. If you're worried, ask your doctor for the FIB4 score, because early detection can save your liver. Current thinking. Dr. Robert Lustig, a prominent endocrinologist in the United States, and others are now saying if your ALT is above 25, it may be an early warning sign of fatty liver, even before other tests or scans show changes. But let me warn you, ALT greater than 25 isn't a dangerous, it's a warning flag. Talk to your doctor. Repeat the test. Check your FIB4 score or liver scan if at risk. We've written a book, Do You Have Early Non-Alcoholic Fatty Liver?, which explains in simple terms. This book is available on our website, free of charge. Please subscribe to our channel to see more videos. Our next video would be how I reversed early non-alcoholic fatty liver naturally. Thank you for watching. See you in the next video.